Over the past week, both through official government numbers and informal reports from healthcare workers, we've seen soaring numbers of COVID-19 cases. These numbers are the highest by far of any point in this pandemic. Even if a much smaller fraction of these cases produce severe illness compared to previous variants, the sheer volume of Omicron cases may overwhelm Alberta's healthcare system. So for that reason, I am today calling on Jason Kenney and the UCP to tell the truth to Albertans about the threat to our hospitals and everyone who relies on them that is posed by the Omicron variant. And this threat is not just speculation. Public health officials in Ontario have reached this conclusion and announced it publicly today. In a graphic they released today, officials from the Ontario government say, and I quote, "Projected COVID-19 related admissions are expected to result in capacity being overwhelmed," end quote. This is an extremely sobering statement from the largest province in Canada. In the worst case scenario, officials are projecting a 7-fold increase in COVID-related hospitalizations in just 2 weeks. Today, the Ford government did take steps to reduce transmission of the virus. So what does this mean then for Alberta and for Albertans and for Alberta's healthcare system? Our hospital system is already in an extremely vulnerable state. To be clear, unlike Ontario, our hospitals were hit very, very hard in the fourth wave, and this created unimaginable stress on our frontline healthcare workers, stress from which they are still recovering. And we also had a very high rate of hospital admissions this fall, and although they dropped a great deal subsequently, they did not resolve completely. And as a result, we are starting the Omicron wave at a much higher level of COVID hospitalization than most other provinces. And so the prospect of yet another wave crashing into our healthcare system is extremely worrying, not only for the Albertans who may be infected with the virus, but also for every single Albertan who is waiting for surgery to address an injury or serious illness, or who may need treatment that they're not aware of yet. Now, the Ontario government put the facts on the table for the people of Ontario today, and our UCP government here in Alberta must do the same immediately. We know that Alberta Health Services maintains a daily 2-week forecast for hospital admissions. We've seen this document many times throughout the pandemic, and we have attached an example of an earlier one to the news release associated with today's announcement, and we've posted it online. The version of that document dated January 3rd is sitting on a government computer right now. Simply put, Jason Kenney and the UCP know what the threat to Alberta hospitals look like, and they must tell Albertans the truth. They should also begin immediately assessing the healthcare workforce, the rate of illness among healthcare staff, and our ability to keep hospitals running properly should a surge in cases in those hospitals occur. We know there are about 6,000 hospital beds across Alberta, but how many are there if a third of our healthcare workforce is away at any given time? Now, I know many of you may be asking whether Alberta should follow Ontario's lead in terms of the measures that were announced in that province today. And I don't know the answer to that question, and I can't until we have the facts about what the coming days and weeks will mean for our hospitals. These facts are available, and they should be shared with every Albertan. If Alberta families and businesses are going to be asked to make sacrifices yet again, it must be on the basis of hard data, and it shouldn't be at the very last minute. I want to be clear. Omicron is new, and it is evolving, and everyone is learning as they go. And so, quite honestly, it wouldn't be fair to expect anyone to have all the right answers right away or all the time. And that actually includes this UCP government. However, we do have a right to expect to see the information that they have, just as Canadians in other provinces have been able to do. That data is available right now, and the UCP must share it with Albertans.